to know how I know the healthcare system is messed up? I'm a chronic pain specialist, and over the years I've seen very complicated, insane, interesting pain cases. And I've had people fly in from across the country as well as other parts of the world. And how I know the healthcare system is messed up is because the cases that I've treated, especially ones who've flown in from other places, have actually not been that difficult. And when I asked the people who flew in from Spain what their providers did for their shoulder pain, and then I asked the person from California who flew in what their providers did for their shoulder pain, the answers were very, very similar. Now, as it pertains to the United States, healthcare is mostly dictated by insurance companies, which then dictate the quality of care that providers provide, or don't. And that's why you get people who've been stuck in pain for years or decades still stuck in pain, because they've been through the system instead of being through what actually is going to work for them. I've had people who've had 8 years of low back pain because of an initial disc herniation injury 8 years ago, and they've done a whole bunch of nonsense. And again, it's not their fault. When I say they've done nonsense, I mean the providers that they've seen have done nonsense for them, have not actually given them a customized, tailored, dynamic, and progressive plan to actually help them out of the hole that they're in. And it's crazy because I can take someone like that and make tremendous progress within just the first couple of weeks, let alone 3, 4, 5 weeks, when they've been in pain for years. The healthcare landscape is, to be honest, kind of scary, because you never know when you walk in to get help from someone, you never know, is this person, do they actually care about me? Do they actually want to provide me with answers? Or are they going to tell me what they've told the last 10 people with low back pain, or the last 10 people with shoulder pain, or the last 10 people with knee pain, the same exact thing? And we all have heard the saying before, one size does not fit all. The healthcare system likes to believe it does, but it doesn't. And something I tell my patients all the time is that, hey, you have shoulder pain. I can have 10 people just like you walk through my doors with shoulder pain and even on paper have the same diagnosis, and I will provide 10 different solutions, 10 different plans, 10 different programs, 10 different home programs. Everything will be different between you and Sally and David and Michael and Robert. Because a little secret, that's the way healthcare should be done. You should have a customized approach. You should have a customized plan for you and your needs. And if you don't, you need to walk that booty out of the office. At the end of the day, I'm very thankful that people have chosen me as their provider, whether they're local to New York or in Florida and doing telehealth with me, or people who've flown in from different parts of the world and decided to blindly trust from social media and reviews on Google, have decided to trust me enough to make that commitment and make that trip over here to get relief, because wherever they are, wherever they have been, has not been able to help them. Those in pain want answers. And sometimes you have to invest in yourself and invest in different decisions and make the bold choice to trust one more time, because that one more time, whether it's with me or another provider like me, you never know when the next provider is going to truly be the one that's for you, who's really going to care about you, who's really going to want the best for you, and is going to want to open up your life, because that's all I want to do for my patients. And look, if you're from New York or Florida, or you want to travel in to come see me, click the link in my bio for a free 30-minute session where you and I can sit down and discuss your own personal case, your own desires, what you want from a provider like myself, what goals you have, what pains you have, what is truly bothering you, because we want to figure this out to help unlock your life, open up your life, and give you back control of your life.